Good afternoon. I am Dr. Patrick Torkson. I'm the Chief Medical Officer here at St. Tammany Health System, and I've been a member of the medical staff for 30 years practicing as an internal medicine physician and hospitalist, and it's nice to be coming to you from the Skybridge this afternoon. We were a high-performing organization with a lot of accolades and recognition even before this pandemic, and I think that all came together and you saw just a really commendable high-level response to the pandemic that's really very much in keeping with the St. Tammany culture and how we are a high-performing organization. Yes, well, coming on today being May 11th, we're now 8 weeks into this pandemic, so we've been at this for 8 weeks now. And very fortunately, we are definitely seeing a downturn in the number of new cases that are popping up in the community, and certainly patients that are having to be admitted here at the hospital, which represents the sickest patients. So I think that we can feel pretty comfortable that our 8 weeks of social distancing and paying attention to good hand hygiene and all the interventions that we've done here in the health system and as part of the community are seeming to work. We're not completely out of the woods yet. There's certainly a ways to go until we have zero transmission in the community, but we've made a lot of progress. A phrase that I hear oft repeated is "can't wait to get back to normal." And so I think that everybody is quite eager to transition back to the way things were, or at least to get to what we're going to call the new normal after the pandemic. And it's probably a little premature right now. As I mentioned, the data is showing that we're still seeing some new cases in the community. It's not time to take our foot off the gas. We have a ways to go. There are a lot of organizations or healthcare facilities around the country that have had a significant number of infections and even deaths. We've had some colleagues get infected. Everybody's back to work, and we just feel really good about the fact that in addition to taking care of our patients and taking care of our community, we're able to protect our colleagues and fellow healthcare workers. We've seen data from around the country that the number of emergency room visits, across the nation is way down. People staying at home and being concerned about coming to a healthcare facility and being exposed to COVID-19. And I would just like to reassure people, that here at St. Tammany Health System, because of the processes and the protocols that we've put into place, we're safer in many respects than we were before, because we're just not going to be caught off guard, and we've got PPE. So I think that residents of our community can feel safe and reassured should they have a non-COVID related illness that they can safely come to the hospital and seek care, whether it's in our emergency room or in one of our clinics. And we have policies and protocols in place now that we're able to separate patients that with suspected COVID-19, so they're not mixed in with the general population of non-COVID related illnesses. Looking at the different areas of the hospital, including the operating rooms and surgery and the emergency department, we're seeing the number of patient volumes pick up in those different settings. Our ambulatory office-based clinics that are part of the St. Tammany Health System are starting to ramp up and get back to normal as well, meaning that our community patients are feeling more comfortable about coming back to those environments to seek care. And I think that everybody should be very reassured that all the lessons that we've learned and all the good results that we've had here at St. Tammany have made us an even more high-performing organization. When we were very high-performing even before this pandemic, I think we actually have more protocols and knowledge and processes in place to make us an even safer organization than we were before. So there's really no need to be concerned about the infection prevention aspect of COVID-19 and coming back to a healthcare facility. As I reflect, just kind of reflect back on this whole experience, going back to the early days of hearing about Wuhan pneumonia coming out of China, and then having our first patient come through the emergency room doors on March 10th. The things that I just feel most strongly about in the story that needs to be told is that we were not caught off guard, that St. Tammany Health System was prepared when this pandemic arrived in our community, and we responded and were able to take care of patients, the first one that walked in the door to the patients that are currently hospitalized, taking good care of them, providing state-of-the-art care, including the appropriate infection prevention measures, protecting our healthcare workers, and then equally being able to now make the shift to get back to normal operations and open up again so that our patients can feel comfortable coming in for non-COVID related illnesses so that we can continue to serve the community. And I think our communications team has done an awesome job, and if there's more information that's needed, you can either call good old phone number 985-898-4001 to get information, or visit our website at sths.org.